45 minutes. Many patients report improvement after just a few treatments. The treatment uses a patented computer-controlled split-table design to gently decompress the spine. A specially designed harness is fitted to your pelvis, then you lie fully clothed on the VAX-D table. Under medical supervision, one of our professionally trained certified VAX-D therapists will start the treatment, monitoring the amount of pressure applied by the computer-controlled table. During the treatment, you will hold on to two hand grips that automatically stop the treatment when released, ensuring safety. The computer-controlled table gently decompresses the spine with intervals of decompression and relaxation. This cycle is what produces negative intradiscal pressure, further explained now by board-certified orthopedic surgeon, Dr. Howard Berkowitz.
When we create a negative intradiscal pressure, the disc behaves like ketchup. Now everybody knows when you open a new bottle of ketchup and you turn it upside down, it just sits there and it doesn't move. But once the pressure is decreased, by shaking or putting in a knife, it becomes liquid and just pours out. The same thing happens with the disc. Negative pressure on the disc makes the disc get liquid and it sucks back into place. The other thing that happens is we cause oxygen transport and nutrient transport across the disc to increase. This results in aerobic metabolism and creates a healing environment for the cells, which actually heals the defect. We have multiple studies showing MRI scans done on the back before and after treatment, showing that discs actually disappear and go back where they belong. This takes the pressure off the nerve, relieves the pain in your back and the pain down your leg, and because it heals, the problem doesn't come back.
Spinal surgery for chronic low back pain has increased markedly over the last 20 years. Recent studies reported that there are 25,000 to 50,000 failed back surgeries per year, often resulting in more pain. One recent randomized long-term study reported that following back surgery by lumbar fusion, there was more pain and disability, and that the patient would have benefited greater from no surgery at all. In the case of back surgery, the doctor cuts into the back. In the case of a disc herniation, the doctor may remove the disc and replace it with bone grafts and screws. Such drastic altering of the normal structure of the back may result in a host of other problems. This may cause the disc above and below the surgery to wear out, often requiring the need for additional surgery. The risk of recurrent disc herniation following surgery is quite high. In the lower back, the failure rate has been reported to be as high as 37% after lumbar fusion and as high as 30% after lumbar surgery without fusion. Careful patient selection and meticulous surgical technique may decrease the need for revision surgery. However, even with careful patient selection and meticulous surgical technique, the need for additional spinal surgery cannot be avoided in many cases. It has been reported that spinal instability was documented in up to 60% of patients who have undergone multiple revisions. In the case of back surgery, there's also the risk associated with general anesthesia, post-operative infection, hospitalization, lost time from work, and not to mention a long period of post-surgical rehabilitation. VAX-D has been hailed as the frontline treatment by the Journal of Neurological Research, stating VAX-D therapy effectively manages mechanical low back pain and helps to restore mobility to the back. The Canadian Journal of Clinical Medicine reports that VAX-D should be utilized in patients with low back pain who have failed conventional therapy. Time and again, VAX-D has proven to be more than 75% effective in relieving pain caused by herniated discs, degenerated discs, facet syndrome, and sciatica. The Department of Neurosurgery and Radiology says VAX-D should be utilized in all patients before surgery is undertaken. It has even been proven effective for those with failed back syndrome. Back surgery was performed and failed. VAX-D provided relief. However, when you seek medical treatment, you want to feel confident that the treatment is going to have lasting results. You may have tried multiple treatments like harmful, addictive medications, injections, epidurals, or even surgery, only to get temporary relief from your low back pain. That's what makes VAX-D different. VAX-D treats the cause of your pain, relieving it and keeping it from returning. Anesthesiology News in March 2003 reported on the excellent results of a 4-year follow-up of patients treated with VAX-D for lumbar discogenic pain. The results indicated that after 4 years, 91% of the VAX-D patients were still doing their normal daily activities, and 87% of them were either still working or had retired without back pain as the cause. Also, there were no complications from the treatment. In conclusion, the 4-year data showed that the pain relief was not temporary, but appears to improve with time. This study is further explained now by anesthesiologist Dr. Robert Odell.
My name is Dr. Robert Odell. I do interventional pain management in Las Vegas, Nevada, and Phoenix, Arizona. I had the honor of participating in a 4-year study of patients who underwent spinal decompression with Dr. Dan Boudreau, an orthopedic spine surgeon from Texas. Dr. Boudreau treated 35 patients with spinal decompression and followed them up 4 years later to see how their status was doing. Of the initial group, only 30% of the patients were working and fully 70% could not work because of the low back pain. Underwent spinal decompression, the initial average pain score was 7.4. That's 1 to 10, with 10 being the worst pain you can imagine. After treatment, the pain scores went down to 3.4. However, 4 years later, about 2/3 of the patients responding to the questionnaires reported an average pain score of 1.5. The majority of patients had no pain at all. What was most remarkable, however, was the fact that fully 70% of these patients were either working or were retired without low back pain. The measure of any treatment is not just the pain score, which is obviously self-reported, but most importantly is the function of the patients. The fact that 70% of these patients were working or were fully functional in retirement is highly significant, because if these patients had not been treated, only 12% would have been expected to be working from actuarial considerations from that 30% without treatment. Spinal decompression is truly remarkable and made a great difference in these people's lives without any risks.
It's amazing to me. This treatment is fascinating, and I've learned so much about myself as not only an individual, but my back and how my back operates, and what I should not do, that kind of thing. And it's amazing. The human body is just amazing.
Oh, I love this treatment. Makes you feel great. You lay there and you get stretched, and you feel energy. To me, it builds my energy. A lot of people think that taking therapy and treatment wears you out. This treatment, this therapy actually energizes me. I feel so much better afterwards. Even the drive home doesn't bother me, because I sit and I kind of get in my chair and I say, this ain't bad. This ain't bad. I feel good.
I'm not one to say this lightly, but VAX-D is the closest thing to a miracle there is. I mean, there was not much else out there, and I researched a lot because I had very little choices, and I had gone to 2 or 3 other doctors and gotten their opinions, and all of them were saying surgery, surgery, surgery. That is the only solution out there except for VAX-D.
The very first treatment was like a miracle. The very first treatment. I walked in here all hunched over in extreme pain. The very first treatment, it alleviated so much of the pain. I mean, the pain wasn't gone, but it alleviated so much of the pain. It was amazing. It was absolutely amazing.
When I got off the table for the first time, I had no numbness in my 2 little toes, which I've had forever. It was all but gone.
The back pain let up almost immediately within the first couple of days, and then decreased dramatically. By the end of the course, a week later, I was on a boat with my wife going to Mexico for a vacation. So, I mean, it was that dramatic.